So on behalf of Lambda Kappa Sigma Alpha Beta chapter, today we are going to be presenting on the health disparities faced in the COVID-19 pandemic. After it was first reported to the World Health Organization in December 2019, COVID-19 was initially declared a public health emergency based on its risk to human health and the amount of international spread. On March 11, 2020, it was declared a pandemic due to the rapid surge in cases and deaths internationally. This pandemic has impacted every single person in so many ways. However, it has not affected all people equally. Numerous health inequities have been further exposed from the spread of this virus, specifically including racial, gender, and economic disparities. There are many social determinants of health that exist, and some of the more predominant ones are listed on this slide. An individual's neighborhood and physical environment impacts the quality of a person's health. People from low-income groups tend to have difficulties finding affordable quality housing, which means that family members of multiple generations may live in one household together, potentially exposing each other to COVID-19. Additionally, their access to nutritious food could be limited in poorer areas, which might put them at a higher risk of more severe COVID infection. There also is a lack of access to quality healthcare, health insurance, and healthcare that has translation services, increasing the risk for poor health and health outcomes. People considered essential workers have jobs where there's a high likelihood of exposure, and they need to keep working to make a living despite the increased risk for exposure and infection. People without online options for their career also face this higher risk. People with lower incomes experience barriers to accumulating wealth and have a greater debt. This often makes paying for quality healthcare, medical bills, nutritious food, quality housing, and childcare very difficult, presenting them with a greater risk of having a more severe case of COVID. They also could have unequal access to high-quality education, which could lead to lower literacy levels, lower high school completion rates, and obstacles to college entrance. There's also limited access to quality job training programs that are tailored to other languages, limiting their job options and making them more likely to obtain less stable or lower-paying jobs. All of these factors might lead to an increased risk of COVID-19 exposure, illness, hospitalization, long-term physical and mental health consequences, or even potentially death.
First, we're going to talk about the racial disparities with increased exposure to COVID-19. People's neighborhoods and physical environments play a big factor into this. People in racial and minority groups are more likely to live in areas with high rates of new COVID-19 infections. People also have increasingly disproportionate unemployment rates during the COVID-19 pandemic, and they often will live in crowded living conditions and unstable housing, which hinders prevention strategies like hygiene, self-isolation, and quarantine. Occupation is lastly another important factor. Racial and ethnic minorities are disproportionately represented in essential work settings, such as factories, warehouses, food processing facilities, accommodations, and grocery stores, but also many more. Racial disparities and risk of severe illness or death is something else we'd like to talk about. People from racial and ethnic minority groups have increased COVID-19 disease severity upon admission to the hospital. Healthcare access can be limited in these groups due to lack of transportation or childcare, inability to take time off work, or communication and language barriers. People also may have increased risk for underlying conditions that increase risk from severe illness from COVID-19. Now we're going to talk about some of the unintended consequences of COVID-19 mitigation strategies on racial and ethnic minority groups. Racial and ethnic minority groups have experienced higher job losses during the COVID-19 pandemic, causing increased financial instability, which may result in the loss of health insurance, reduced access to health care, and food and housing insecurity. Food insecurity occurs when people do not have stable access to food or do not eat consistently because of a lack of money or other resources. Higher percentages of food insecurity occurs among non-Hispanic Black adults, Hispanic or Latino adults, and people of other race or ethnicity compared to Hispanic, white, or Asian adults. The COVID-19 pandemic has been stressful for many people. However, some groups have been more affected than others. A study found elevated depressive symptoms and fear of COVID-19 among racial and minority populations compared to non-Hispanic white people. Lastly, many people have experienced grief during the COVID-19 pandemic. Grief can happen in response to loss of life and due to drastic changes in daily routines and ways of life that brings us comfort and a feeling of stability. Non-Hispanic Black people are also more likely to have had a close relative who died from COVID-19.
Another disparity that we have seen due to the COVID-19 pandemic has been that between genders. One of the main things we've been seeing is an increase of gender-based violence against women specifically has increased due to both social and economic stay-at-home orders forcing people to be together with their potential abusers. We've also seen a reallocation of resources that is taken away from reproductive health services for women. And this has led to only exacerbate maternal mortality, as well as increase the rates of adolescent pregnancies and STDs. It's estimated that in the Latin American countries alone, 18 million women have lost access to traditional contraceptives. We've also seen occupational sex segregation. Women make up 70% of the health workforce and are a majority of the frontline workers, which has led to them being disproportionately exposed to COVID-19 as well as contracting it. There's also been an increased demand for unpaid care work due primarily to school closures, which for many people is the traditional form of childcare that they rely on. This has caused economic strain for women who have been forced to leave their jobs, as well as difficulties for frontline workers who can't leave their jobs and have struggled to find another alternative for childcare. Female students learning from home are also being asked to take on more chores, and compared to male students, chores due to gender stereotypes on who should be doing chores at home. And this also translates to women spending 3 times as many hours as men in unpaid care work due again to gender stereotypes. Girls are also, during the pandemic, at a higher risk of dropping out of school based on trends during previous epidemics where women and girls have dropped out of school and did not go back.
Economic disparities and employment. Lower-income employees oftentimes work in the service industry. But why settle for these lower-paying jobs? There was pre-pandemic growth in high-paying and low-paying jobs. However, mid-level jobs began to disappear. Due to the disappearance of middle-level jobs, these individuals with limited opportunities sought lower-paying jobs with less hope for career advancement. Unfortunately, many of these jobs were lost permanently during the pandemic. This is because the service industry offers limited job security. White-collar jobs have been greatly recovered post-pandemic. However, there was a reduction in the workforce of the service industry due to slower in-person business during this time. Many jobs offered temporary furlough, but even in the event of temporary furlough, families may not be able to sustain themselves for an extended period of time without pay, especially if they're relying on paycheck to paycheck for their rent or other expenses. Even a month-long furlough is detrimental to the family's health. Additionally, temporary furlough quickly became permanent job loss in many cases. Job loss during COVID-19 has increased by 125% in the year 2020. This graph clearly displays the loss of temporary jobs, permanent jobs, and the total jobs lost in the US throughout various recessions experienced. The COVID-19 pandemic has caused the highest incidence of unemployment since the Great Recession, with 3.8 million permanent jobs lost and a total of 4.5 million jobs lost. As a result of low employment or job loss, low income employment or job loss, there has been a significant impact on health during the pandemic. These individuals have had less access to personal protective equipment. This is because their budget has a limited portion of their income to spend on these resources. Additionally, if they're unemployed as a result of the pandemic, their personal protective equipment is not supplied by their employer. Another complication presented by employment in the service industry is the inability to work from home. Many white-collar jobs were converted to remote work. Therefore, higher income employees were able to work from home safely. The service industry is strictly in person. Therefore, there is a higher risk of exposure in these lower paying jobs. So why is working in person a higher risk? Because commuting to and from work on public transportation, contact with surfaces, objects, and tools in person, and close contact with employees, coworkers, and clients. So what is currently being done to address this situation? There was a FEMA van that has started in Bridgeport, but travels to 17 communities in total throughout Connecticut. This van will have 6 vaccination stations within it and travel to areas that are experiencing low vaccination rates. Bridgeport is the first community impacted, and still only 17% of its 14,400 residents have been vaccinated, with numbers much lower for those that are Hispanic or Black. This service allows community members to arrive without an appointment and eliminates the need for electronics. As a result, more people could be vaccinated despite location or access to electronics. The Families First Coronavirus Response Act was enacted by former President Donald Trump and states that those with private insurance, government insurance, or even those without insurance will receive free testing to ensure that all citizens have access to testing. So what is currently being done? Employing contact tracers that are bilingual. Contact tracing relies on community trust. Trust is built very quickly when contact tracers and community members are able to communicate freely through their preferred language. The CDC is increasing collaboration with partners affiliated with underserved communities to provide scientifically accurate information to partners who can then deliver it to their communities in a way that fits their needs and allows information to be translated when needed. So the CDC has set guidelines that outline the goals that they're going to achieve in the upcoming months. Many of them target health disparities that have emerged as a result of COVID-19. One of their major themes that runs throughout all of their goals is the hope to disseminate as much scientifically accurate information as possible to as many communities as possible. One of the major ways that they are trying to accomplish this is by increasing the diversity of the response teams to hopefully build trust within communities, as well as allow more clear communication.
There are a lot of resources available to those experiencing hardships from COVID, one of which is the American Medical Association's Center for Health Equity Resources on COVID. And if you go to their website, they have data collection, state tracking, race and ethnicity data, and health literacy resources for non-English speakers. The graphic on the right is from covidtracking.com, which has all of the data listed here. And the Global Healthy Living Foundation and the National Alliance on Mental Illness offer services like free mental health support, patient support programs and groups, and a helpline and email, which I've included here on the slide. The links to some more resources available are below, and these include a COVID-19 emergency toolkit, which has substance use and behavioral health treatment services over the phone, frequently asked questions about how and where to find treatment and have access to medications, how to practice safer drug use in the pandemic, overdose prevention with naloxone, and additional up-to-date coronavirus information. There are resources for immigrants with information about healthcare access, immigration paperwork, and DACA renewals, cash aid, and tips on how to build your immune system, how to make your own hand sanitizer, how to talk to loved ones about COVID, and how to relieve the anxiety of COVID. The Coronavirus Response Toolbox has endless resources on guidance for different communities, how to protect yourself and care for your family, current data available, guidance for good health, and tools for public health action. EmbraceRace.org has stats and helpful tips involving racial disparities, student information, and help for families. There are emergency financial resources for COVID, like grants for individuals, nonprofits, or small businesses, international aid, and other forms of relief. And 211 has different ways to help during the COVID pandemic for things like paying bills, mental health sources, and how to find resources near you. So these are our references, and please check out any of the links provided in this presentation if you're looking for any form of help or aid getting through the COVID-19 pandemic. Thank you for watching our presentation.